Hi, good afternoon. I'm Dr. Joshua Deering, and I want to welcome you to our first Lunch and Learn Ask the Doctor series. I'm a vascular surgeon, and I will be speaking to you today about the different causes of leg pain and how we evaluate them and how we treat them. As this is a Facebook Live event, I welcome you to ask any questions along the way. As they pop up, I'll do my best to try to answer them, or we'll save them at the end to answer them all together. So a little bit about myself. I grew up in North Carolina. I went to college at Duke University, and then I did med school at UNC Chapel Hill. I did my general surgery residency up in New York City, and then I came back to DC for my vascular surgery training. And then I liked it so much in the area, I decided to stay, and I've been working here ever since. So I really enjoy the area, and I really enjoy the people here, and so it brings me a lot of pleasure to be able to help everyone around here. So some of the main causes of leg pain can be broken down into one of two things. That's either problems on the arterial side, which the arteries are the parts of the body that bring blood from the heart all the way to everything that's far away from the heart, all the way to your fingertips, to your toes. And you can have pain for different reasons in the arteries, which we'll talk about in a minute. What brings blood back from all of those parts of your body back to your heart are your veins. So they do a little bit different functions, and as a result, they can give you different causes for pain. Now, one of the more common causes of leg pain that people may experience is that they have issues with their veins. Now, our veins are supposed to make sure that the blood only goes back to our heart, but sometimes those veins don't work properly. And the reason that happens is it's usually genetic. It's not anything that you do, it's not anything that happened, but sometimes your veins just don't work as well as they used to. And so what we have to do is try to figure out whether your veins are working properly or not. And one of the main ways that we do that is just with a painless ultrasound. We take a look at the veins in your legs, see if they're working the way they're supposed to, and can decide if you need something to help you along with that. Now, people who have leg pain from veins, unfortunately, can have a lot of different symptoms. Sometimes it's a little tough to pin down exactly why you would have leg pain from your veins. So most people complain of heaviness in their calves or their thighs. It's usually worse after you've been working for several hours or been on your feet for several hours. Some people will notice swelling, like they'll notice swelling in their ankles at the end of the day, and then when they wake up in the morning, they'll notice that their legs are back to normal. Or you may have visible veins. You may have spider veins or larger veins, or even sometimes those bulging varicosities, those varicose veins, which can indicate that you're having some kind of venous problem. So what we do is, if you feel like that's the source, we have you come in, we do that ultrasound, we take a look at you, and we can see if there's anything that we can do to help you with that. Vein problems are not life-threatening or limb-threatening. The main issue with vein problems is, of course, just discomfort. And the main treatment is just wearing compression stockings, which doesn't sound amazing, but they do help people feel better, and they're actually pretty simple to use. If you have bigger vein problems or have something that we can address, sometimes we can do injections or do small procedures to either get rid of those veins that are not working or do things to improve your symptoms. And these are all very minor surgeries or procedures, some of which we do in the office. Now, Deborah from Waldorf posted a question, and she said that she gets a lot of nighttime Charlie horses. Is this a symptom of something that's more serious, and how can I avoid them? So again, sometimes people do have cramping in their legs at night from vein problems. Again, it's very tough to tell without getting the whole story. Sometimes people get Charlie horses in their legs just from not having enough potassium or magnesium. Usually it's not a sign of anything really terrible. It's just one of those little things that you can fix with either like a vitamin or with getting a vein workup and seeing if there's anything that we need to address on that standpoint. So In terms of other issues that can happen with your legs, if they're not caused by spider veins or varicose veins or swelling like that, you can have problems with your arteries. Now, having arterial problems is a little bit of a bigger deal because arterial problems are actually an issue with blood getting to the tissues, the muscles, the skin in your legs, your feet, and your toes. And so we want to make sure that if you have that problem, we do things to avoid and improve that. So people get problems with their arteries because they get plaque buildup in those arteries. And it's the same thing that happens in people's hearts that cause them to get a heart attack, but instead of the plaque building up in their heart, it builds up in the arteries of their legs. Now, people get plaque buildup for a couple of different reasons. A lot of it is genetic. Some people just unfortunately build up more plaque than others. But there are some causes of plaque buildup that can be modified or can be treated. So some of those causes, the number one, the biggest one, is smoking. So if you're a smoker, this is going to accelerate the building up of plaque in the arteries that go to your legs, to your heart, and even to your brain. If you have high blood pressure, it damages and irritates the arteries, and as a result, you can have more problems with plaque buildup. If you have diabetes, unfortunately, diabetes leads to an acceleration in the buildup of this plaque. And finally, which makes the most sense, if you have high cholesterol. Now, most people with high cholesterol at this point, again, it's genetic. You do have some high cholesterol from your diet, but a lot of it is from just being lucky in that genetic lottery. Now, how do we fix that? You know, a lot of people ask me, is there a medication that I can take for having this plaque build up in your arteries? Now, everyone has some plaque, but the question is, do you have too much? The main thing to do is to kind of modify those risk factors that we mentioned. So if you smoke, you should try to cut back and quit smoking. If you have high blood pressure, control your blood pressure. If you have high cholesterol, we have medications for that. If you have diabetes, obviously you understand that's a very difficult problem, and you do your best to control it, and the best that you can do can help with this. In terms of other medications, aspirin is a very great medication. If anyone identifies any kind of plaque in your heart or your legs or anywhere else, you should probably be taking a baby aspirin every day if you're not allergic to it. And this is something you should talk about with your primary care doctor, or you can talk with any of your other doctors. In addition, the two other things that can help with the plaque buildup in your arteries involve exercising and eating right. Now, neither of those sounds fun, but they are very helpful at decreasing the plaque buildup, and in some cases can actually reverse some of the blood flow issues that you have. So Rachel from Clinton posed another question I'm going to address. She says that she's 28 and has diabetes. She doesn't have any leg pain at this point, but she knows she's at an increased risk of having vascular problems or leg problems. She wants to know what she can do to lower those as she goes forward. So again, the big things are, for diabetes, it's maintaining a good A1C. All of you out there that have diabetes or know someone with diabetes, you know that the A1C is a magic number. So if you can keep that number as low as possible, you prevent diabetes from damaging any of the parts of your body, including the arteries in your legs. And then, of course, the other thing you can do is just the simple act of walking 3 times a week for about 30 minutes. You don't have to jog, you don't have to run. Just walking at least 3 times a week for about 30 minutes can actually help the blood flow in your legs. It helps remove a little bit of that plaque, and it also helps your body grow new blood vessels around the problem. And in addition, like I said, you can manage all those other issues, your cholesterol, your blood pressure, and smoking, which I know is very difficult to fix. Now, people who have arterial problems, they usually have a more distinct set of symptoms. So with veins, it's a little complicated because sometimes you can just have heaviness or cramping, or as Deborah said, you can have Charlie horses at night. If you have arterial problems or real circulation problems, The main thing you're going to notice is that when you're walking a far distance, or if you're doing more strenuous walking, like walking uphill or upstairs, you're going to notice calf pain. Your calves are going to hurt like you just ran a marathon. And you're going to have to stop after a period of time. That pain's going to go away. You're going to start walking, and then it's going to come back. That is the most telltale sign of having some kind of arterial leg pain issue. And it affects a lot of people. Most of the time, it is not life-threatening or limb-threatening. It's something that we can address simply and get you feeling better with either exercise, medication, or sometimes small procedures. Now, when you have worse circulation problems than that, sometimes you can develop pain in your feet or your leg all the time. Sometimes that's only better when you kind of let your foot or leg drape in a dependent position or down so that gravity can help the blood flow. And then, of course, the most serious sign of having blood flow issues would be if you had any kind of wounds on your feet that did not heal. And again, if you're a diabetic, you've understood, people have talked to you about this, but for everyone else, you may end up getting a wound that would not get better over the course of a week or so, and that may be because of poor blood flow. Now, Aaron posed a question and wanted to know, are regular leg cramps when laying down a sign of having any issues? Again, it kind of depends on the frequency and when and some of the other things that we would see on in an exam. It could be from, again, an arterial problem or a vein problem. It would be something that we'd have to check out in the office and figure out what the best test for you would be. But usually if you're able to walk without pain, that's a pretty good sign. Laura also posed a question, at what point would you recommend getting a small procedure done for this? I think that comes down to a discussion that we would have in the office. It depends on how much this leg pain bothers you. I have patients who come in and they tell me that they only get leg pain when they walk 2 miles. And in that regard, they're probably okay. But I also have patients who can't make it from the car to the door of my office building without having problems. And now those people probably need a little more than an exercise regimen and aspirin. So though it kind of depends on, does it prevent you from doing your job? Does it prevent you from playing with your kids or with your grandkids? Those kinds of things, if you're not able to live your best life because of this leg pain, then I think it's time for us to talk about doing something a little more invasive than just, trying aspirin and an exercise program. We have another question. Megan from Brandywine wants to know, she says that she's pregnant with her first child and that leg pain and cramping is fairly common. What symptoms should make her more concerned? Pregnancy is a big, is a factor that can worsen any kind of vein problem. So a lot of women don't notice that they have real bad vein problems until after they've had their first or second kids. Mostly it would be leg swelling and pain that was constant. That would be a worrisome sign. If you get it periodically or if it's things that are worse when you're on your feet, that's kind of just normal vein issues with pregnancy. But typically pain that you have that's consistent, pain that doesn't really get better with anything, would be more worrisome. Erica wants to know, is there a way to tell whether the leg pain is from something cosmetic or something that's a bigger deal, and who can help determine that? Sometimes your primary care physician can help, but usually you need the input of a vascular surgeon like myself to determine whether this is a cosmetic problem or something that has a more significant underlying cause. And again, the test that we would do would be something like an ultrasound to take a look. We have a lot of questions now. Kate wants to know how quickly symptoms may improve or be resolved after treatment for arterial disease. That depends. It kind of depends on how bad your blockages are. If you have some mild blockages, taking an aspirin and walking around, you may actually feel better in a couple of weeks. If you have fully blocked arteries, you may need something like a stent or something to balloon open that blockage. Most people feel better almost immediately after the procedure. The next few days when they're able to walk around, they feel a lot better. Some more questions. Debbie wants to know that she says she's having issues with cellulitis in her right leg, and that she's had normal testing, but she can't get rid of the cellulitis. She has diabetes, high cholesterol, high blood pressure, and that sometimes she has numbness in her feet. Is it time to see a vascular doctor? It may be. It definitely sounds like you have a lot of things going on, and potentially blood flow issues may be contributing to that. One of the other things that can contribute to cellulitis and leg swelling is the final topic that I wanted to talk about today, which is something called lymphedema. Now, it's a lot more common than people talk about. But it's not life-threatening, so it doesn't get a lot of attention. But a lot of people can have swelling in their legs that extends past their ankles onto their feet, which can cause a lot of discomfort, or sometimes people can have cellulitis. There's a lot of different treatments for lymphedema. Lymphedema can come from cancer, can be genetic. It can happen from surgery. So if you've had a lot of surgeries in your abdomen, in your belly, or if you've had your hip or knee surgery, sometimes you can develop lymphedema. Now, the main treatment for lymphedema, or these swollen legs, again, is compression stockings. But if you truly have lymphedema, we can get you signed up for either a lymphedema pump or to present you to the lymphedema clinic, both of which help people feel a lot better. It's a little bit tough to diagnose, and it's one of those things that if you feel like you either want to make an appointment with a vascular surgeon or have your primary care doctor refer you to a vascular surgeon. Belle asked, how do you know if you have a blood clot in your legs? That's a very good question. It's definitely something that you see in the news and on ads because there are a lot of new medications for blood clots in the legs. That would be, again, pretty consistent pain in the leg that did not get better. Usually it comes about after things like a long flight, like if you fly for over 8 hours, or if you spend over 8 to 10 hours in the car. But again, sometimes people just have a little bit of swelling and a little bit of pain, and if it's something you're concerned about, you would need to get an ultrasound to really take a look. And then one of our final questions for right now is Nick from Upper Marlboro, and he wants to know, why are my legs numb if I stand for a long period of time? And that's a good question, Nick. A large part of my job has to do with trying to determine where are people's leg pain coming from. Now, I talked a lot about the vascular reasons of leg pain because that's what I do each day. But sometimes you can have leg pain from other things, such as things like back issues or spine surgery or nerve injuries. If both of your legs are numb at standing, or it's worse when things like walking upstairs, that may be more of a spinal cord or back issue. And sometimes one of the biggest things I do is actually tell people that they don't have a vascular problem for their leg pain, that it's actually just from their nerves or from their back, and then we get them set up with the right person. So some of the patients that come through my door, they don't actually end up having a vascular problem, which is good, but sometimes they just need to have that screened out so that they can present to the appropriate doctor. Now, in terms of trying to figure out whether you have an arterial problem or not, the main thing that we do is we see you in the office and we check to see how strong your pulses are. Some other tests that we can do involve checking the blood pressure in your legs compared to your arms. So if it's a lot lower in your legs, that would let us know that you have some circulation problems. We can do some ultrasounds, which give us an idea. And then if we need to do something more invasive or something to get a better picture, we can do CAT scans or we can do angiograms. Now, angiograms are one of the mainstays of both identifying and treating vascular disease. And that basically involves a small in and out procedure that we do here at Southern Maryland Hospital. And what we do is we just put a small tube inside the artery, and we use contrast dye to look at the blood flow. And it gives us a real-time picture of how blood is flowing in your legs. Can let us know if you have a blockage or if you have some tight spots that's hindering blood flow from getting all the way to your toes and to your leg. And those are things that we can fix at the same time. Sometimes all it takes is a little ballooning. You balloon the blockage out of the way. Or sometimes we put a stent, which is like a small mesh metal tube that pushes the plaque against the wall, keeps your blood vessel open, and helps blood flow by. Again, these are small procedures. Chances are you know someone who's actually had one done because it's not an uncommon problem. And so if you come in to see us, that would be some of the things that we would take a look at. Like I said, we would check the blood pressure in your legs. We would take a look at your legs. And sometimes we'd order some other testing. And then if you felt it was bothering you enough and we felt that you had a big enough problem, we would schedule you for something like an angiogram, which would let us look at that blood flow and potentially treat you. I know none of this is stuff that people don't like going to the doctor, and people don't like starting new medications, but these are things that can adversely affect your life, and it's better to get it treated sooner rather than later. So that's most of the talking that I have to do. I hope I was able to explain kind of the three main issues with leg pain. Like I said, most of it comes from the veins, which we can fix with relatively simple ways. Sometimes you have problems with circulation with your arteries, or sometimes you have swelling from what's called lymphedema, and again, there are things that we can do for you. So if you are having leg pain, or you're suffering from discomfort or swelling, or you're not able to do the activities that you used to, speak with your primary care physician doctor, or make an appointment with us. I see patients every Friday here at Southern Maryland Hospital. We still have plenty of room for new patients. You're able to call my office to make an appointment. I'll list it here, and hopefully they'll be able to also put it out there so you guys can find it. But the number for my office is 301-877-7353, and that's 301-877-7353. And we're more than happy to see you for any of these issues, or even just to tell you, you know what, you don't have a vascular problem, but here are some other doctors you may need to see. You may need to see an orthopedic surgeon. You may need to see a back surgeon. And I'm more than happy to help you get on the track to feeling better and getting back to being as mobile and active as you want to be. So if there's any other questions, we'd love to answer them. But I think that ends my lecture part.